The huge impact that coronavirus is having on the NHS was made clear today as new figures revealed just how many people have now been waiting more than a year for routine hospital treatments and operations. It's at its highest level in England for 12 years. By September, almost 140,000 people have been waiting more than a year for non-urgent operations like hip and knee replacements. Compare that to the month before the pandemic hit in February this year, when just over 1,600 people had been waiting that long. And it could get worse. Some hospitals around the country have started to cut back non-urgent work even further in recent weeks. Our health editor Hugh Pym has more.
It's another cruel consequence of COVID. Routine operations and procedures were cancelled to clear hospital beds for coronavirus patients earlier this year. That's meant long waits and increasing pain for many other patients.
And he said, "This isn't even up for discussion. You need both hips replaced."
Since last year, Helen has struggled with arthritis in her hips. She was told she needed a double replacement and went in for a pre-op assessment in September, but she's heard nothing since.
I'm in quite a lot of pain. Some days are worse than others. Sometimes I go into a spasm. It's just the not knowing. I don't know whether I should be walking. I don't know whether I should be sitting down, resting. There's just nobody telling me what I should and shouldn't do and when it might happen.
Hospital leaders argue that since the summer there has been a big increase in the number of patients getting non-urgent treatment as COVID pressures eased, but it's been hard to bring down the backlog and cope with new work coming in. Cancer treatment has been affected too, partly because people might have been worried about going into hospitals. Around 888,000 patients had checks for potential cancer between April and September, but that's down 27% on the same period last year. The number actually starting treatment was 121,900 between April and September. That's down 22%. NHS England says cancer services for new patients coming forward to their GPs and then needing treatment are back to where they were before the COVID crisis. But charities and campaigners argue that a backlog of work has built up over the last 6 months, and that has been harmful for some patients.
It's incredibly serious. It's probably the worst cancer crisis in my lifetime. And the problem is cancer doesn't wait. There's data out now saying that even for a 4-week delay, you can have an up to 10% reduction in survival.
Sarah had successful treatment for colon cancer and is in remission, but she needs restorative surgery. There have been delays and she hasn't been told when the next operation will happen.
Being left in a state of not knowing because there isn't really anyone to call because they're all too busy. You know, someone like me who is recovering from cancer, but, you know, it's not life or death, you are just left in a sort of wasteland with sort of not knowing what's going on.
Because of the surge in COVID cases and admissions of more seriously ill patients, some major hospitals are having to postpone non-urgent surgery again. That can only mean waiting lists getting longer and more discomfort for those who've already faced frustration and delays.
Well, the latest government figures show 563 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. It takes the total number of deaths so far across the UK to 50,928. And there was also a big spike in new cases with 33,470 new coronavirus infections recorded in the latest 24-hour period. That's a record number. And the average number of new cases per day in the last week is now 23,857. Well, Hugh is with me now. That big spike in new cases, it's thought that that was to do with the gap between a second lockdown being announced and coming into force and people just going out and about.
Yes, Sophie, there are, of course, caveats not to read too much into one day's figures. They are quite volatile. But Public Health England, who compiled them for the UK, say, yes, these are genuine new cases that have emerged over the last couple of days and just been reported. And if you go back 5 days or a week, that's the length of time it takes to develop symptoms and go for a test, you get back to those few days before lockdown was imposed in England and presumably more people going out and about and the virus spreading more. Now, we'll have to see what happens in the next few days to the daily case numbers, but a certain percentage of these people will become seriously ill, sadly, and end up in hospital. That'll put yet more pressure on those hospitals needing to find beds for COVID patients, and of course less capacity to deal with routine operations and procedures, as we've been hearing, and maybe more delays and a bigger waiting list developing.
Hugh, thank you.